Push off this leg, we'll get you to the sideline, all right?
Is that uncomfortable or you just feel it?
Does that feel tight on that side?
Every single day you have to adjust to the new challenges that walk in the door, the different types of student athletes, whether it's a volleyball student athlete with shoulder pain compared to a soccer athlete with shoulder pain. You might treat them similarly, but at the end of the day, they have different requirements that they need in order to play their sport.
I think the best part of my job is seeing the athletes, perform to their best, bringing, a guy from being injured and then rehabbing him, taping him, bracing him, what have you, and then getting them back to playing and kind of seeing them be successful on the field.
Not always easy to have the clinical skills at hand because you can see anything, but trying to keep a level head and let your skills and training take over is the best approach. You don't necessarily have to have all the answers in the moment, but hopefully you have enough to get to where you need to go, and then you can bring in reinforcements and go from there.
We cover about 15 high schools and college universities in the Metro Detroit area. And then we have 2 athletic trainers with the professional teams for the Detroit Pistons and the Detroit Lions. Every athletic trainer has at minimum a bachelor's degree. Over half the staff has a master's degree. Everybody has taken a national certifying exam, and because of passing that exam, they were able to get state license in Michigan to be able to practice athletic training. What
I enjoy is trying to teach the athletes about muscles, joints, about their body, and kind of how they can improve things, whether it be flexibility, strength, and kind of help teach them and give them the knowledge that they can use.
If there's a difference between treating athletes at the pro, college, or high school level, I think there really isn't at the end of the day. You're still trying to do what's best for the athletes. You're trying to give them the best care that they all deserve.
Those people you interact with see as the liaison for the health system. So carrying yourself to a good standard and hopefully giving them a good impression. You definitely have to be flexible and be able to roll with everything that comes your way throughout the day, though. So I think that's a huge part of being an athletic trainer.
Working with these kids is great. They all have energy. These are young athletes. They have energy, they want to have fun. They're out here to have fun and have a good time, and also to do it as good as they can on the field.
The athletes, they do trust us at the end of the day because we deal with them on a day-to-day basis. And so you do create a unique relationship, a great working relationship with them.
Shoot, where else can you just be outdoors, watching sports, but also, when you care about people and you're able to show that through the way that you take care of others, you can't beat it.
We go in, boots to the ground every single day and do everything that we can possibly to help our student athletes excel at whatever sport they're trying to play.